So for most of us nurses, after nursing school, we end up specializing in a particular nursing field or even multiple, as much as you can handle. Some pay really well, both home and abroad, while others, they don't pay as much. And let's be honest, aside passion, aside liking the profession, you want to get something, a good take home from what you're doing, of course. But here's the catch: not all pay realistically well here in Nigeria, as juicy as they may sound, I promise you. And that is what we are going to be talking about today. So hi, there is Anastasia Obilo here. If you're coming across my channel for the very first time, you're welcome. Please stay and please do not go anywhere. And how do you not go anywhere? By subscribing to my channel, like this particular video if you end up liking it and you picked something from it. And if you're an OG here, thank you for tuning back in. So 10 nursing specialties that don't pay as much here in Nigeria. In no particular order, let's just start. Number 1, public health nursing. A public health nurse, as we all know, work in communities towards disease prevention, immunization, maternal and child health programs, towards prevention of prevailing diseases, education of the public, and the likes. But are they being paid well? Compared to the work that they do, are they being paid well? I'd say no. They are not. 2 agencies that they will most likely work under: government agencies or non-governmental organizations. For government agencies, I promise you, they don't pay as much. They don't pay as much. But for non-governmental organizations, very few non-governmental organizations pay very well. And in most cases, they are international NGOs. Yes. And how many people can get international NGOs? How many? Like, how many can actually get international NGOs now? It is very competitive. International NGOs like WHO, UNICEF, they are very competitive. How many nurses can actually get in there? But for some other NGOs, they do not pay as much compared to the work that they do. Government agencies, you know the rest. Even worse. But let me know if you think otherwise. So number 2, geriatric nursing. So what does a geriatric nurse do? I don't even know if I'm pronouncing it right. Please let me know in the comment section. So what does a geriatric nurse do? A geriatric nurse primarily cares for aged and elderly patients, if they have underlying disease condition, or if they're just aged and need taken care of. They need actual assistance. They need proper management from professionals. Are they valued as much as they are valued abroad? No. You, as an African, as a Nigerian, will you keep your aged mother, your aged father in a nursing home? Unless they have an underlying disease condition that they need management for. So it's not realistic for Africans, for Nigerians to have their parents in nursing homes. Like I said, unless they have underlying disease condition that needs proper management from professionals. And how many nursing homes do we even have here in Nigeria? How many care homes do we have here? So do you expect geriatric nurses to be paid well? They are not. So number 3, oncology nursing. What does an oncology nurse do? An oncology nurse manages a patient who has been diagnosed with cancer, towards chemotherapy, radiation, and just management of their symptoms in general. Are they being valued here? Are they being valued in Nigeria and paid enough? No, they are not. A typical Nigerian, a typical African with money would rather go abroad because he feels he can get better treatment there. 2, there are very few specialized centers here in Nigeria. And for the very few specialized centers we have here, they do not pay well. So number 4, occupational health nursing. So first of all, if you know anywhere in Nigeria where this is being studied, please let me know in the comment section. I'm curious. So anyways, what does an occupational health nurse do? An occupational health nurse works primarily in corporate settings towards promoting health, safety, prevent hazards, educate the employees on their health management, and minor injuries at workplace, those kind of things. But realistically, you would expect that, a nurse like this, a nurse of this caliber is working in a corporate setting like this. You're going to be paid moolah. At the end of the day, not all these multinational companies we have here in Nigeria end up looking for these specialists. They might end up employing a registered nurse without that certification. In most cases, just to save costs. You know, the more the grammar, the more the money. So number 5, nephrology nursing. So what does a nephrology nurse do? He or she has a responsibility towards management of patients with kidney failure, dialysis treatment, education of patients with issues concerning your kidney, basically. First of all, dialysis treatment is expensive, but does it reflect on the pocket of a nurse? No, it doesn't. It just ends up reflecting on the pocket of the hospital, not on the nurse. I bet you. And lastly, the job demand in Nigeria is quite limited. So number 6, this one is debatable. Mental and psychiatric nursing. So what does a mental and psychiatric nurse do? She or she has a responsibility towards the management of, just like the name implies, mentally unstable patients. Schizophrenia, paranoians, depression, and the likes. Thing is, mental health awareness is still quite low in Nigeria. We are still coming up with regards, issues pertaining our mental health. So the demand for it here in Nigeria is still not on the high side. So number 7, nurse researcher. So what does a nurse researcher do? So a nurse researcher has a primary duty towards making research on, ways to improve healthcare, innovations, all those fancy things. Where do they work? They work in health institutes, even universities, I think. Do I need to say too much? What are you really researching? Are they really researching here? Do we research much here? Do we need a nurse researcher here as much? Please let me know in the comment section, because I feel I don't need to talk too much on this particular one. How much grants will you even get to fund the research? Like I said, I don't need to talk too much. So number 8, school nurse. So what does a school nurse do? A school nurse has a primary role to provide medical care to students in school, just as the name implies. Treatment of minor injuries, first aid treatments, educating the students on, their hygiene, preventing diseases, and the likes. Are they being paid well? How much do teachers even earn in schools? Not to talk of the nurses, even if that is priority in a school. At this point, I don't know which is worse. Is it the government schools or the private schools? Which do you think even pay better? Is it the government schools or private schools? So number 9, midwifery. Okay, I know this one too is debatable. No, we have amazing midwives that are earning so well. How much does the majority earn? So if you don't know, a midwife has a responsibility towards child delivery, pregnancy, everything maternal and child health. Everything maternal and child health. That's who a midwife is. But are they being paid well? I won't lie. In most hospitals, in most hospitals here in Nigeria, a midwife is being paid very well. So number 10, aesthetic and cosmetic nurse. So an aesthetic and cosmetic nurse works primarily in beauty clinic and all things skin treatments, laser treatments, Botox, and the likes, everything beauty. And it will surprise you to know that it's even the non-professionals that are taking over this industry. The demand for aesthetic and cosmetic nurse is quite low here in Nigeria. Usually doctors and even non-professionals. And most skin beauty clinics that are in demand for nurses actually end up employing registered nurse. But let me know your opinion. Do you agree with me entirely? Is there anyone in particular that you strongly do not agree with me? Please drop your comments in the comment section. I want to hear them. I really, really want to hear them, because this is based on my research. I might be wrong. You might be right. And like this video, subscribe if you haven't subscribed at this point, and I'll see you all in my next one. Bye.